Are you able to hear me okay? Can you hear me? Just want to make sure my audio is coming through, that there's no lags or anything like that. How did you put a background in Zoom? We usually use Teams. I should see about doing that for our agency. Hmm.
Yeah, it there's a similar process. It's been a minute since I did it, but
Okay, cool. Very cool. All right, so I just wanted to make sure I'm coming through clearly, so that's great. I'll go back to muted.
yeah, you're good. I'll hand it off to you when it's your time and we'll probably start letting folks in here actually probably right now. So I'll go ahead.
Perfect. The slide deck looked good though?
Yes, perfect. Thank you so
Wonderful.
much for
All right,
sending that
no
over.
problem. I'll just be off video, and when it's my time, I'll pop on and yeah.
Okay, sounds great. Thank you. All right, I'm gonna go ahead and start letting them in. But actually, Kenzie, do you mind just you can just start letting people in. We can just go ahead at this point.
Cool.
Good morning, all. Welcome. Thank you for joining us. Good morning, everyone. Thank you so much for joining us. We really look forward to having you participate today in our learning collaborative. We will give it a few more minutes as people continue to join, but we would welcome you to introduce yourself in the chat if you're interested. We'd love to hear what organization you're with and the role that you play there. And again, welcome, and we'll get started here shortly.
See all the Amazon orders and no light has been.
Good morning, everyone. Thank you so much for joining. We will give it a few more moments here, a few more minutes as people continue to roll in. We are so grateful to you for joining us this morning. We always like to land here on this Welcome to the Learning Collaborative screen and remind ourselves of our intention for this morning, which is to dedicate a few hours to this topic to learn more about ways to support our communities. So we appreciate you for taking time out of your day. We look forward to your contributions to this conversation. And again, I welcome you if you are interested in introducing yourself, you can do so in the chat. We'd love to hear about the organization that you're working with and the position that you play there. So thank you so much. We'll get started here shortly. All right, well, we will go ahead and get started here. We'll probably continue to see a few people roll in. And again, if you're welcome to introduce yourself in the chat. And we will get started with our learning collaborative this morning. So the topic of our learning collaborative this month is the Washington Health Benefit Exchange, preparing for open enrollment. So we are really excited to have the Washington Health Benefit Exchange here today, joining us to share about the exchange, the open enrollment, and some of the ways that our community can help support that and in connecting clients to insurance coverage. So recently, Greater Health Now became the lead organization in part of our region, and we'll also have Kristen Charlotte from Greater Health Now to talk a little bit more about that. So this topic is really, really important to us. Insurance is one of the, or support in connecting to health insurance is one of the main topics that brings people to our community care hub. They're looking for support on that topic. So we're really excited to be able to expand our support of health-related social need here in our region. Greater Health Now is committed to being a neutral convener. We're always excited to bring experts in the field to provide real-time information about current topics. Often we are learning alongside our audience as in the ever-changing landscape of healthcare. And we just want to ensure that you know that we know every single organization represented today will have a different relationship to this topic and different factors that influence how you relate to the information shared. And in no way are we proposing that there's only one correct pathway. So thank you so much for being here today. We really appreciate it. And let's talk a little bit more in depth about what we're going to learn today. So our learning outcomes this morning, you'll have a chance to learn about the benefits of becoming an assister and the training required to become an assister for the Washington Health Benefit Exchange. You'll understand the importance of the approaching open enrollment, sort of what that means, what it entails. And then you'll also get to gain some knowledge about Greater Health Now's role as a lead organization for the Washington Health Benefit Exchange. So to start us off, we have Alex Johnson, Kelly Aaron, and Kristen Phillips from the Washington Health Benefit Exchange. They will present and you'll have a chance to ask some questions throughout that presentation and following that presentation. And then we'll roll over to Kristen Charlotte from Greater Health Now. And with any time remaining, we'll circle back for additional questions for both Kristen or Alex, Kelly, and Kristen from the Washington Health Benefit Exchange. So we are so grateful to have Washington Health Benefit Exchange here today. We have Alex Johnson. Alex has been with the exchange for 4 years, and his responsibilities in his role as a senior navigator program specialist are to support application support, facilitation, certification, training reports, outreach, and communications. His strengths lie in organization, project management, communication, and both technical and analytical assistance. And joining Alex is Kelly Aaron, and in her role as a navigator support manager, Kelly has been with the exchange for 9 years, and along with her team, she oversees training, certification, and application support for over 1,000 statewide assisters. Kelly believes everyone should have access to quality, affordable healthcare. Kelly is a subject matter expert in Washington Health Plan Finder and content development. And additionally, Kristen Phillips will be joining. Kristen has been with the exchange for 8 years and is responsible for creating newsletters, creating and publishing training for certification, and much of the resources in our learning management system. And Kristen specializes in the learning management system / SharePoint, storyline and training content, and Adobe Campaign. So I will turn it over to you, Alex and team, and please just let me know when you're ready to advance the slide.
Perfect. Sounds great. Before I jump in, I just want to make sure, can everyone hear me okay online? Perfect. So we're going to present today. I'm Alex Johnson. I'm the Senior Navigator Program Specialist here. I've got my team members who are attending virtually as well. They'll be monitoring chat, and we're going to field questions afterwards. But we're very grateful to be here and excited to present a little bit about what the Navigator program is, what being a navigator / assister entails, and some very important information on the climate of the health landscape right now and how we're continuing to address affordability barriers. So we can move to the next slide. Thank you. So what is the Navigator program? So the Navigator program, it's a statewide composition of organizations that conduct public health education, outreach, and really provide high-level enrollment support for Washingtonians seeking access to healthcare. And our Navigator program constitutes navigators, tribal assisters, and certified application counselors as well. Now, to the right, we have included the updated lead organization map, which you can see encompasses Greater Health Now as a new lead organization for this year. And really, the work that the Navigator program surrounds is addressing disparities in healthcare access and just working to bridge access to healthcare in general by managing and helping supplement the access to healthcare for people needing that assistance. We have the lead orgs specifically, and then to the right, you can see all the different areas that they encompass, and then their contact information as well, which is really great for reference. You can move to the next slide. So our team currently has Kelly, who had an introduction, Kristen, and then myself. We support 1,000+ assisters statewide, so it's been a very growing program, which we're happy to relay back. We've seen a lot of growth in certified application counselor agencies. There's been growth in the tribal community, and then also growth in our lead organization conjunction of users as well. So we support them. Our Navigator program does the trainings, the quarterly trainings and annual trainings, user access agreements, and provide ongoing application assistance and certification assistance and high-level account support as well. We really seek to be accessible pretty quickly for any sort of escalated needs and work alongside our enhanced users to make sure it's as seamless as possible. And then our team initiative, we seek to build and support the statewide Navigator network to reduce systemic barriers in accessing healthcare. So that is our team specifically, and we're really here in the weeds looking to support everyone who is taking on this healthcare bridge with us. We can move to the next slide. So who are our partners? We have 8 lead organizations. And so a lead organization with the assistance of an enhanced user provides high-level, multi-level support to the navigators that they facilitate. They can be employed directly by that lead organization, or they can be employed by a partner agency, which will have an MOU contract with them. So there's 140 community partners within their service area. And then we have 21 certified application counselor organizations. They assist uninsured individuals and are a point in service. So there are a lot of hospitals, clinics, nonprofit organizations will contract as a certified application counselor organization, and then they'll have a coordinator at their facility, and then they'll have certified application counselors under their purview. So we provide assistance for them as well, training, answer any questions that are needed. And then 36 tribal organizations I want to highlight, we do have representation for all 29 federally recognized tribes as well. The number is 36 because there are some additional facilities outside of that. And happy to also provide information that over the past year, we have, for the first time in exchange history, established our tribal lead organization, the American Indian Health Commission, who has an enhanced user now. It's been really great fostering that growth. The Navigator program was able to attend the tribal event, their annual event, and really work alongside the enhanced user and be accessible for questions, panels, things like that. Tribal assisters support American Indian and Alaska Native individuals who apply and have access needs to healthcare as well. So we've really worked to grow the program and encompass a wide range of needs and access care. You can move to the next slide. So you might want to know, what is a navigator, right? We talked about the Navigator program. So the Navigator position specifically was created by the Affordable Care Act. Essentially, it's assistance, providing help for people to enroll in coverage, and that's through state and federal health insurance exchanges, and also with Medicaid enrollment. So Washington Apple Health is our Washington State Medicaid program. And mind you as well, that's ongoing support too. So it's not just the enrolling of coverage. It's if there's a change that needs to be updated, if there's correspondences that need to be answered, navigators are vital in facilitating it and making sure the enrollments are able to stay active without barrier. An assister is not a licensed health insurance broker, so there's not an ability to recommend one plan over the other or to direct consumers towards a particular policy. It's really just providing assistance to consumers, providing general information that makes it easier to decipher what the plan information is, and to make sure in terms of coverage that they have their needs met and based on their financial needs as well. Assisters are paid by state and federal grant programs, and they cannot be compensated, directly by the insurance companies. So what assistance can an assister or a navigator provide? They can maintain expertise in eligibility, enrollment, and program specifications. So that would mean if they have someone who wants to enroll in coverage, they would know how to navigate the health plan finder landscape to look to get them enrolled in either a qualified health plan or a state Medicaid plan as well. An assister can conduct outreach and consumer awareness activities, so they can connect on their behalf to do correspondence needs and things like that to synchronize the enrollment. An assister can provide complete, fair, and impartial information. So that would be non-biased, of course, but all of the facts and information so that their clients are well informed on what they're enrolling in, what their coverage needs will be, and what their potential out-of-pocket costs will be as well. And then they can facilitate selection of health plan. So that means if the customer identifies their plan of choice, the assister can then make sure that they can work to effectuate that enrollment and make sure that they're enrolled in the coverage that they need. They can make referrals to consumer assistance or Asotin programs and meet confidentiality and privacy standards. We are very much aligned with keeping confidentiality and privacy. That's something we'll continue to highlight. Due to a multitude of reasons, we want to make sure that the clients that we support and the navigators are very good about that as well. Keep discretion and stay in compliance with protected health information. You can move to the next slide. So navigator training and certification, this is something that I do specifically right now, and Kristen is an expert in it as well and covers when I'm out, because being a part of the navigator program means there are quarterly training requirements to ensure that you retain health plan finder access. Assisters must meet cultural competency standards, and they have to go through training and certification prior to receiving access to Washington Health Plan Finder. So essentially, when they're going to be enrolled, they'll either be enrolled as a Role 1, which is strictly Washington Apple Health Medicaid program selection ability, or if they're enrolled in Role 2, they'll have the ability to do Medicaid programs or qualified health and qualified dental plans. That part of that onboarding process requires these role trainings to make sure that cultural competency is such an important thing. We want to make sure that navigators have the understanding and expectation to follow that and be mindful of the clients that they're supporting, and also have program information provided to them. The certification is offered through our learning management system. It's essentially a virtual training program. You'll have a training dashboard and be able to access the training needs that you have. And it does consist of knowledge checks as well, so that we know that the coursework is being followed, different scenarios, and interactive content that'll help understand complex topics that may arise in the line of work. Exchange certification requirements are to complete that onboarding training. Existing assisters are required to complete quarterly, so fall, winter, and spring. And then a background check would have to be on file with their agency within the last 2 years. And that stays that way. So if they're onboarded, they'll have to have an active background check ran within the last 2 years, and it'll have to be maintained within that 2-year period. If they do fall outside of 2 years, we then would put them on hold until that's updated. But we're very good about running monthly audits that show the prospective expiring background checks within the next 60 days to reduce the amount of having to do that. And then they'll have to complete a user access agreement form during that initial onboarding, and once a year for existing assisters, because we do have privacy and security updates. So we'll have them re-sign a user access agreement, and then they'll be good to go. Complete security and privacy training annually as well, just to make sure that we're in compliance with security and privacy needs. You can move to the next slide. So navigator support. So we're here to provide that. Assisters have year-round access to additional resources on LMS. We have vast resources. We're expanding them all the time based on changes in the health or federal landscape. The navigator team creates additional site pages, training, and one-pagers per assister request based on the needs of the exchange. So if a navigator or a lead organization or one of our partners feels that there should be information provided or wants certain information, we're always happy to fulfill that request and make sure that it's accessible for the full assister network. We'll typically provide outreach as well to that network that there's been some resource updates so that they know where to look and how to access that need. Our team does manage 2 assister email inboxes as well. One is strictly for application support needs, and the other is for certification support. And that reduces having different types of inquiries sporadically put together and make sure that we can best answer and have high response times as well. These inboxes are accessible by our full navigator team, and they are the best route to ensure the inquiry is reviewed, because if someone's out of office or on leave, everyone that's in place would be able to see that need. So our general questions and application support, high-level escalations, go to navigator@wabexchange.org. And then if there's a certification or a training question or an LMS training need of that sort, we would have them connect with navigator.lms@wabexchange.org as well. I do want to highlight that screenshot to the right there kind of shows what it would look like. There's an LMS dashboard there, and you can see right below it, it says My Training Dashboard. That's where the navigator or the onboarded navigator going through training would be able to access their course requirements. And then 2 over would be the resources tab at the top. That's where they'll be able to have access to all of the LMS resources. And we have resources not only from our agency, but we have them linked as well from the Healthcare Authority and other state agencies that have very vital information that a navigator would want to know, even directly outside in case they need to connect their client with additional resources. You can move to the next slide. So now we're going to talk about some eligibility and plan information. We can just jump right into the next slide, and I'll get started on that as well. So premium alignment, I just want to kind of talk about this. Right now, obviously, there's affordability barriers. We all know about it. It's continuing to get tougher with federal subsidies being reduced. So premium alignment will increase these available advanced premium tax credits for our qualified health plan customers. And so I wanted to kind of talk about this. Silver plan rates will be increasing up to 30%, but we will see a slight reduction in our gold and bronze plan rates. So silver plans in many scenarios will be more expensive than gold plans. And as we move to the progressive slides, we'll be able to see what we're doing and why to make sure that we address affordability barriers. But to the right, you can see the chart there. That's the average rates by metal level for plan year 2025 and moving into plan year 2026 as well. And so we see bronze for 2025 is at 433, and for 2026 it's at 503. The biggest jump we'll see is the silver plan. Goes from 543 to 762, but gold goes from 611 and drops down to 598. So we can move to the next slide, and I'm going to talk about our new Vital Gold plans and things that we're doing to make sure our clients have affordability barriers addressed. So if silver plans are getting more expensive, should anyone enroll in them? Customers up to 200% federal poverty level would still have a heavy benefit from silver plans because they're considered CSR Tier 5 and CSR Tier 6 eligible. And those silver plans would cover 87% and 94% of costs on that scenario on average. So for them, it would be a good option. It's really our customers over 200% federal poverty level that are going to see a shift where they would want to go towards a gold or bronze plan. And in the subsequent slide, we're going to talk about our newly available Cascade Care Vital Gold plan because it was specifically designed to offer lower cost, high access to coverage for customers who are not eligible for CSR 5 or CSR Tier 6 based on their federal poverty level percentage. Now, if you really want more information on what premium alignment is, and then access to premium alignment frequently asked questions, we do have those links below, hyperlinked and accessible for you. We can move to the next slide. Our new Cascade Vital Gold plan. So this plan was designed for this upcoming plan year to offer a lower cost option for customers who are not eligible for those Tier 5 or Tier 6 CSR tiers. Customers currently in a silver plan who are not eligible for 5 or 6 are going to be cross-mapped to the Cascade Vital Gold plan. That means their plan will be migrated to Cascade Vital Gold plan, and it will be less expensive and provide greater coverage with access to the same providers, prescriptions, and service that they currently have. And we can move to the next slide. We'll talk about a customer-facing example. So here's our illustrative example. It helps explain this very well. So example, Gabriella, 40, lives in Seattle. Gabriella's annual income is $38,000, which is 250% of the federal poverty level. Now, in the previous slides, we talked about if they're above 200%, that's when we'll see a lot better opportunity at the lowest cost gold plan, the new Cascade Vital Gold. So what we're going to do here is look at the charts below. You can see for plan year 2025, for that silver, it would have been a net out of pocket of $0, right? But that moves to $186 for plan year 2026. So silver, the silver plan would be $186 out of pocket. But for the lowest Cascade Gold plan, it's actually $16 due to the way we have navigated this new Vital Gold plan and structured it. So the out-of-pocket original is $298, but due to the applicable cost savings, the net premium would only be $16. So it would be much more efficient and affordable for Gabriella to be in our lowest cost Cascade Gold plan, and also very high coverage to access care needs and providers and prescriptions as well. We can move to the next slide. So here's our coverage generosity and cost by FPL, federal poverty level. And this is among our APTC eligible enrollees, so eligible for tax credits here. And here's where that highlight of the FPL percentage really helps. And FPL is based on income. That's your percentage, right? So for silver, when you see there under 200%, there's high access. It's very affordable. And then as we migrate above 200%, on the FPL percentage, you can see that those red circle lines are through it. It's just not going to be the best opportunity for coverage, access to care, or out-of-pocket expense. And that's really where we see gold take precedence as the most feasible option for our customers. We can move to the next slide. We do want to provide update for our DACA lawful presence update. So DACA recipients were previously eligible for tax credits. Lawful presence for DACA recipients currently enrolled was recently updated from yes to no, so they were migrated to not lawfully present in the system. Correspondence explaining the change has gone out to our affected customers effective August 25th. A special enrollment period was open for those who would qualify. Now, mind you, that would be for full cost qualified health plans in certain situations, but it is eligible for a special enrollment period. But they were system migrated. An example of our correspondences that would have been generated is to the right. We blurred out the name for privacy and confidentiality, but that's an example of what they're receiving. And it's because of the federal changes in the federal landscapes. We can move to the next slide. So this is a great link. We have hyperlinked right under for updates visit. This is our exchange initiatives page. It has really important information. Different administrative changes will be tracked. And so you can really see a lot of initiatives and what we're really looking at on the horizon by accessing that link. You can move to the next slide. There's upcoming tax credit eligibility changes as well. Want to talk about that. So effective January 1, plan year 2026, individuals with income below 100% federal poverty level who are ineligible for Washington Apple Health due to their immigration status, they will no longer qualify for tax credits either. Impacted individuals losing tax credit eligibility, they will be eligible for the maximum amount of Cascade Care savings for plan year 2026. And I want to talk about that. So even though they're not eligible for those federal tax credits, the Washington Health Benefit Exchange has secured our state-funded Cascade Care savings for plan year 2026, and it is available regardless of immigration status. We're happy to announce that. So they'll be eligible based on their income for the maximum amount. We do not have specific per member per month numbers right now, but as soon as they're applicable to be shared, we will share them. They will be published to the community so that they know what their maximum will be eligible for. You can move to the next slide. So healthcare insurance laws are changing. We have a correspondence out for that. That was sent late August. That's to all of our qualified health plan enrollees. And really, we're advising our customers to use their health insurance now. Affordability is changing, accesses can change. So this is an example. It talks about now is the time to use your health insurance. Your monthly insurance costs could increase due to changing federal tax credit support. And so that's something that we're mindful of and continuing to address and make sure that our clients know while you have the most applicable cost savings, it's a good opportunity and time to use the coverage needs that you have. You can move to the next slide. Here's an important reminder on renewals. So the exchange, we conduct a process called trial eligibility, and this is in mid-October. It's used to determine if customers are eligible and have enrollment qualifying for automatic renewal. So they'll be auto renewed for the following plan year. The process only includes enrollments that are already active and paid. So they had their binder payment made, the enrollments are effective by October 1st, 2025. Active enrollments that cannot be auto renewed, they'll receive correspondence alerting them to manually renew during open enrollment. But one caveat we want to highlight. If there's a customer that a navigator is supporting that does not have active coverage by October 1, and they newly enroll in a plan for November or December start dates, they will not be auto renewed because that trial eligibility marker was for October 1 and previous. Those customers with those November or December start dates would have to manually renew their plan during open enrollment to avoid being terminated for non-pay. We've run into situations, someone effectuates an enrollment in November or December, they're assuming it'll be auto renewed, and unfortunately that's not the case, and then we run into some trouble with coverage. Customers in this scenario will not receive correspondences either because it's obviously after the October 1 cutoff, so they would not receive that correspondence alerting them to manually renew like the other enrollments that were not auto renewed would. And they will not be included on the manual renewal open enrollment report either. So it's very important that they're apprised by their navigator or assister to go in and manually renew their coverage for the following plan year. You can move to the next slide. Now we're going to move to some important updates. We've got quite a bit to share here and happy to do so. We can move to the next slide again. So open enrollment OE13 readiness. Our Navigator program is hosting an informative webinar for our Navigator network, and this is to learn about really important updates for plan year 2026, such as the ones we've discussed here on very high level. The training will explain plan certification for plan year 2026. It's going to talk about cross-mapping examples with that new Cascade Vital Gold that we touched in on, premium alignment and a deep dive, changes to tax credit eligibility for our customers, and then qualified health and dental plan renewals. And these are going to be virtual sessions that are eligible to be attended by our Navigator network in October. We can move to the next slide. Happy to talk about the AI chatbot feature. So our Washington Health Plan Finder online hub is going to have a chatbot feature. And this is going to be available to not only our assister network, but to customers. So it will be customer facing as well. And it's really to mitigate the need for a customer or assister to have to sign into the account or call or do an email when they have a quick basic access need that's going to be interactive. So that chatbot will be able to answer many questions that customers may have without needing to call in and be on a hold or a wait time. And so we're very happy about that. You can move to the next slide. We had an exchange corporate website update, wanted to provide imagery for that so you can see what's customer facing. Again, this is our corporate website, so this is what it looks like. We tried to make it very seamless, and we're continuing to do so pretty much annually with making sure our platform is accessible, legible, and has basically all the information that it would need to be system navigated. You can move to the next slide. Correspondence languages update. So we did receive funding to expand languages from 8 to 16. To the left, you can see our current funded languages, and then the ones being added are to the right. We do not have a specific date where they'll all be up, but it will be before too long. Funding already has been approved, so we're happy about that. And our exchange did add a language access manager within the past 2 years that has really addressed linguistic need, and we're continuing to look at how to address that and make sure everyone has their not only verbal ability to speak the language they desire, but to have it in print as well in assistance. You can move to the next slide. This was a really important slide our Navigator program wanted to include as well. So these notations are from our actual Washington Health Benefit Exchange board members. And I'm not necessarily going to read all of them, but a couple of them. We have your back. We stand with you. We are so fortunate to have such hardworking, knowledgeable staff who care deeply for our customers. And really, one thing I want to leave you all with is our exchange is progressive, not only in equity and access to care needs, but really in addressing all of the affordability barriers we're here to support our navigator network, our partners, people that we interact with in the community. It's really our life's work and life's mission. And we understand the complexity of the federal landscape right now, all of the cultivated fear that has for a lot of people trying to have access to care needs. So we're here to navigate this all together in conjunction and continue to, in these uncertain times, find ways to rise above. So again, I'm really happy to be here. Kristen Charlet, your enhanced user who's going to present next, has been instrumental in connecting with me. So I'm very optimistic and very gracious for my opportunity to work alongside you here at Greater Health Now. And yeah, we can move to the next slide where I can talk about our contact information and then take some any panel questions that we might have. Here's our contact information. To the left near the phone moniker, you can see our customer support number. That's where you can call in if you have phone needs there. And then we also have our HTML corporate website there and our WA Plan Finder mobile app. And these are all hyperlinked to the right. You can move to the next slide. We wanted to provide our social media information as well, which you can access by clicking there. And that'll have important updates or media things that we're campaigning for as well to show updates for WA Health Plan Finder. And on our last slide, we have our contact. So if you have questions, Kelly Aaron is our navigator support manager. Her email is listed directly there. And then for assister support, there's our navigator drop-down email as well. We do respond. We say 24 hours, often much quicker. We're here to bridge any disparities that you all have and answer any questions and resource needs that you have as well. In the heart, you can click where it says here to stay informed. That will receive regular updates from our agency, the Washington Health Benefit Exchange. Now that concludes my presentation material, but I'm happy to answer any questions virtually now, and also my team's in chat as well to answer any questions you may have. Thank you for your time.
Thank you very much, Alex. I really, really appreciate it. We will absolutely send these slides out following today's session. And so you'll have a chance to engage with all of those links. And we absolutely have some time for questions. I know I have a few percolating, but does anybody have any questions before we roll on to Greater Health Now's presentation? I see in the chat that Emma has a question. Emma, would you like to unmute or would you prefer to type that out in chat?
Okay, can you guys hear me?
Yes, we can.
Absolutely, yeah,
Okay,
we can.
perfect. Well, thank you very much, Alex. I do have a question. When it comes to calling when we have issues or whatever with the Washington Health Plan Finder contact number, they always want the patient there. And sometimes we won't have them there with us. So is there any way we can go over that barrier?
So Emma, so you're saying when you want to contact on now, would you be connected as a navigator on their
Correct.
application?
Correct. Yes.
Yeah. Okay. So Kelly, do you have anything to add specifically on that?
Yeah, thank you. Hey,
taking,
Emma, good morning. So as a partnered navigator, you should be able to speak and receive help from the Exchange
Right.
Customer Support Center. Sometimes the Healthcare Authority call center might have different guidelines around that. So if you call the Exchange Customer Support Center and you receive any pushback, shoot us an email. So that navigator inbox, let us know the app ID that you were working on, and we can pull the call and review it and then work with our call center management to provide training to that representative.
Perfect.
So I appreciate you bringing that to us. Yeah.
Thank you.
Yeah, thank you, Emma. And I added Kelly on that because that was my presumption as well. If you're listed as a partnered navigator on the application, you should be able to call our customer support center without issue. They should be able to see you as the partnered navigator. And as a partnered navigator to an application under the Health Benefit Exchange, you don't need to be listed as an authorized representative as well. But I do know that the Healthcare Authority specifically has some different processes in place around reps and what the need would be to call. But if, like Kelly said, please connect with us if you run into that barrier with our agency.
Thank you so much for that question, Emma. So Alex and Kristen and Kelly, I do have a question. So we have some navigators here on the call. Thank you all so much for joining. For those of on the call who might not currently be navigators or who are considering becoming navigators for themselves or their team members, do they still have time to do that before open enrollment starts? Do you have like a general idea of how long it takes to get through the navigator onboarding process?
Yeah, I'm happy to answer that. So first, a navigator can be registered to be, you can be registered to become a navigator. There's no certain date timeline for that, so it can be done at any time. The onboarding process itself, it differs depending on if they're just going to be a Role 1 navigator, which would mean they're specific to Washington Apple Health enrollments, or if they're also going to be a Role 2, so they would then be doing qualified health plan and qualified dental plan enrollments as well. So for Role 1 navigators, the training is just for Role 1. It typically takes, it can take a few hours of LMS coursework training. And then there's going to be a user access agreement that we would send out via DocuSign, where they would go ahead and do a virtual signature for that. And then the last component would be the job shadow, which typically the lead organization will have an established navigator shadow them. They'll have examples of what the work is, and then they'll fill out that job shadow form where the trainer has their name, date, and signature, and then the trainee has their name, date, and signature, which is then sent off to us, and then we go ahead and save that for record, and then we would subsequently create their health plan finder account and make sure that they have the access they need. So, I mean, if they're very quick to work on the training, you could get it done probably, I would say definitely same day, sign the user access agreement, and then the job shadow process would be whenever that's able to be scheduled with your organization. Now for Role 2 navigators as well, there's some additional training that would take feasibly maybe a couple other hours just for Role 2 to understand the qualified health plan landscape, because that is entirely different than Washington Apple Health enrollments. But we have definitely seen learners have the ability to do Role 1 and Role 2 training even in a day of dedication, and then you can have that user access agreement signed pretty quickly, and then it's just the job shadow. Now, again, I do want to highlight that does require an active background check, so if they don't have one in place, your agency would be able to run one for them if there's not a current plan in place. Also, the Washington State Patrol does those and gets those back typically within 48 hours. Onboarding process has to be done within 60 days. I will say that. So that means when they're registered to become a navigator, they will need to complete their onboarding LMS coursework, the user access agreement, and then that job shadow within 60 days. It did used to be 30. We expanded it, but it's plenty of time to do that.
Phenomenal. Thank you so much. That's very exciting.
Absolutely.
And then I do have one other question.
Sure.
If others have questions, feel free to also put those in the chat, raise your hand, or unmute, and then we'll roll over to Kristen. But there's been a lot of news going on about changes to Medicaid eligibility, and you did a great job covering some of the specific changes that we are seeing. I know in our initial conversations leading up to this, you mentioned that there were some changes that might be being talked about that aren't actually active this open enrollment. Are you able to talk about that a little bit?
So specific to Medicaid, that's going to be under the Healthcare Authority purview. Their government affairs directors and their strategy and policy will be the ones to relay those. We work tangibly to help facilitate Medicaid enrollment. So the Health Plan Finder has our online hub for qualified health plan or Medicaid plans, but all of the actual Medicaid plan eligibility requirements and all of the updates around that specifically fall under the Healthcare Authority directly, and we are not directly affiliated with them. So I can talk kind of about, the federal changes that are proposed around, reduction of federal subsidies, changes to, there's been CMS rule changes that require stricter qualifications around renewals, making it more difficult for customers to do self-attestations. There's going to be federal hub verification a lot of times for income and eligibility, but the specific Washington Apple Health changes we don't have concrete information on. That will have to come from the healthcare authority directly.
Okay, so if people are hearing from clients that they might be working with that they don't think that they are going to be eligible based on things that they might be hearing secondhand or in the news, would you recommend that they just, connect them and encourage them to really check those eligibility requirements because it may that, things they may have heard might not actually be in place just yet?
Yeah, and a lot of things too, the cultivated fear right now is valid. But some of the things to have finite accuracy, I would 100% recommend they contact actually the healthcare authority directly. HCA has a direct phone number. I'm happy to drop that in chat as well for reference for people wanting to connect with them. And then they also have their own sort of virtual chats on their HCA website as well. And then they have a contact us link where you can get clarification and have resource information requests. So I'll go ahead and drop their phone number. That's going to be their customer support center number, and they can direct them to anywhere also inside HCA they need to go for their specific inquiry.
Thank you, Alex. I really appreciate it.
Absolutely. Yep.
Any other
There's their number.
questions? Any other questions that are coming up for Alex or the Wabi team?
Well, if you guys think of anything, I know it's a lot of information dump at once. If you guys think of anything you have questions on, resource needs, clarification needs, want to connect with us in any way, please connect to our navigator support email, and I'll make sure to get to you and make sure that you're looped in on anything that you are inquiring about. But again, we're very grateful to be here to collaborate with Greater Health Now and to provide opportunities for access to care needs and information and training. I appreciate your time.
Thank you so much, Alex. And we will have some time at the end if you have additional questions that come up between now and then. But with that, I will roll over into introducing Kristen Charlet from Greater Health Now. So before joining Greater Health Now, Kristen spent over 20 years in public service, primarily with the Washington State Department of Social and Health Services. Her background also includes managing community partnerships, working closely with tribal organizations, and advancing equity and access in healthcare and human services. In addition to her state work, she has held several leadership positions in nonprofit organizations, including the YWCA and Junior League of Yakama, where she focused on community engagement, fundraising, and program development. So thank you so much, Kristen. I will hand it over to you. Just let me know when to advance the slides.
Thank you so much. Well, hello, everybody. It is so exciting to have you here at the Learning Collab and seeing some navigators in the audience. I'm just thrilled to be able to speak to you today about what Greater Health Now's role is within the Washington Health Benefit Exchange. As Danny mentioned, my name is Kristen Charlet, and I'm the Health Benefit Exchange Manager. And I started this position in July 9th, actually. So I am onboarding and learning everything as we are going, but this has been a great an interesting shift of careers from working with the state and now working in a nonprofit. It's just been a lovely transition, and combining all this information into this role has been pretty seamless, but a learning curve for sure. So Danny, thank you so much for the introduction, and I'll go to the next slide, please. So narrowing the scope down from the Washington Health Benefit Exchange kind of down to Greater Health Now's role, and talking a little more local to the audience. So our role in Greater Health Now within the Health Benefit Exchange, my role is to make sure that navigators have everything they need, and that is the navigator coordination role. So we work within several counties in southeastern Washington where we are promoting our equitable access. So as Danny mentioned at the beginning of this, we have Greater Health Now has a hub where people can access services. And one of the greatest needs that have been identified is healthcare. And so when Greater Health Now took on the responsibility of the lead organization for this, our region. That is how they kind of answered the call to creating more of that equitable access for healthcare. And we have also are beginning now to streamline the insurance support. So that means bringing on a navigator team, making sure that they have everything that they need as we develop our team and our pace for before open enrollment. And so that is what we are doing at Greater Health Now. And next slide, please. So our regional coverage is within 7 counties, and we aim to improve the regional healthcare and coverage access. And so again, making sure that we have navigators that are represented in all the communities that we serve. And we also work with our Greater Health Now community engagement specialists to make sure that we are doing custom outreach events as needed. We just started talking about the health benefit exchange with the public from Greater Health Now. And so we're getting a lot of interest and a lot of community members coming out wanting to hear more. And it's perfect timing, Danny, that we have this for our Learning Collab this month to be able to do some more outreach and talk to our neighbors out in our communities. Next slide. So I just kind of wanted to call out some of our organizations that are working along with us. So we have multiple organizations, and I'm going to shout them out right now. We have Benton Franklin Health District, Comprehensive Health, Ideal Option. We have R1. We have Whitman Hospital and Medical Center, and Yakama Valley Farm Workers Clinic, and Tri-Cities Community Health. We are also adding again back into our roster the Columbia County Public Health. They just hired a new navigator, which will start October 1st. And so we're very excited to have them back. Their navigator retired, and so they just got somebody back. So we are so excited to welcome them back. But these are the organizations that are getting it done. Like when I talk about the work that has been produced by this team, it is truly phenomenal. And I just cannot praise them enough because they are out there making sure that folks are being connected to quality healthcare plans, whether it be Medicaid or whether it be, a nominal fee, not so nominal sometimes, but just making sure that people have health equity access. And that is really why we are here for Greater Health Now. That is why we decided to take on this huge responsibility of being a lead organization and coordinating all these amazing navigators on our team. So we have our navigators who are doing the eligibility screening, the application health, and also providing some guidance for the folks that call in and are in need of assistance. Insurance is an incredibly complex thing where I still have questions and I'm still learning every day just how we fit into this role, not only within insurance, but also looking at federal changes and how we're going to meet the needs when the landscape changes for that. So we do provide access to healthcare through multiple settings. So we do go out into different forums, and we also work with community centers, organizations. We do our outreach events. We also have, assistance in places where there are healthcare providers as well. And we also have a healthcare broker who also works with us, and he, is a private business, but he feels very committed to making sure that people in our communities have equal access to healthcare as well. And we're very dedicated to reaching diverse populations in our region and making sure that we are going out and meeting people where they are and being able to spread that information in a culturally and linguistically appropriate way. Next slide, please. So our impact in our vision in being a lead organization for the health benefit exchange, we want to reduce uninsured rates, and we want to build public trust within our region. We want to improve those public health outcomes, and we have our ongoing commitment to efficiency, innovation, and equity. So making sure that all of our navigators feel supported and that they feel that they are heard, making sure that they are up to date on the most current information that is provided. As Alex mentioned, that is an ever-changing landscape. I mean, insurance always has been. I know my premiums one year just shot way up through the roof, and I had to change my plans because I simply couldn't afford to spend that much. And so making sure that we have our navigators ready to have those conversations, which perhaps may become increasingly difficult as we progress through the next few years, and making sure that they feel supported is of utmost importance to me and Greater Health Now. Next slide. So currently we have 8 community partners. We have 36 wonderful navigators, and we are looking and doing specific strategic outreach to the communities that do not have community partners. So that's in Garfield and Asotin counties. And I am very excited to say that we have new sites coming in those, at least in Asotin, and another one just starting in Walla Walla County starting soon. And we, as I mentioned before, we have our enrollment center, which is the advisor health benefits group here in our county. And for some reason, I cannot remember, he's in Kennewick, but it is, he's very dedicated to assisting, and he's also considering adding a navigator to his team as well. So next slide, please. I want to thank everybody for sitting through these slides with me. You will see the QR code, which will take you to the Greater Health Now Health Benefit Exchange page for more information. Navigators, I will be coming out to your sites and scheduling you to meet you in person, and to be able to connect with you and hear of any needs that you have. There's my contact information, and please let me know if you have any questions. I am, like I said, I'm in a steep learning curve right now, but I am very enthusiastic and excited to help you at whatever needs you have. So are there any questions, I guess? Danny, I'll just hand it over to you.
Yes, absolutely. We can definitely, are there any questions for Kristen? Thank you, Kristen, so much for covering that information. We're so excited. Any questions for Kristen about Greater Health Now or anything in our region?
I think they're being very kind to me. Just kidding.
Wait, well, it sounds like you're getting a lot of praise in the chat. So thank you so much, Kristen. And of course, Kristen's contact information is here. We do have a question. Angie asked, if someone wants to become a navigator, would they contact you directly? Is that the step they should take, Kristen?
Yes, they are. Anybody is more than welcome to reach out. So how it typically works, and I think Alex described this somewhat, is that we go into a partnership with the facility or the nonprofit or the agency that you work for, and we establish a memo of agreement, and then we then move forward with getting the navigator trained and do their background check, and all of that falls into play very quickly. We just brought on Blue Mountain Heart to Heart, and it has been a very easy process for them. And I work with Christy Kane from Greater Health now to establish those contracts, just making sure that our needs are established and their needs are established, and we have that agreement together. And then, yeah, we just go right through the navigator process. It's very, very easy. I see Emma has a question. I'm a navigator, but think of retiring in 5 to 6 years. Would I contact you if I'm still interested in staying as a navigator? In order to be a navigator, you have to be working for an organization as well. Does that answer your question, Emma? So we have to have that memo of agreement established with the place of work. Okay, great. We'd love to have you forever, Emma, but I understand retirement is a thing too. Can you be a volunteer assister under HCA? Oh, Kristen is saying you can be a volunteer assister under HCA after you retire. I didn't know that. Thank you, Kristen.
Fantastic. Any other questions that you all might have for Kristen or Alex or Kristen Phillips? We all the Kristens today. Um, Great. Well, thank you all so much. We will as I shared, the slides will be available. Don't hesitate to reach out to any of our presenters today. They'd be happy to answer any questions that arise for you after today. So we do have a few things that from Greater Health Now that we'd like to share, and then we will conclude today. So we wanted to make sure that people knew that our Mobile Integrated Health Symposium is happening October 10th, and registration is still open for that. So if you are interested in attending, it'll be taking place October 10th here in Pasco, Washington. And you can purchase tickets on our website, but if the cost of tickets presents a concern for your attendance, please just reach out and we'd be happy to work with you to ensure you can chat. That is the place to look for more information on that event if you are interested. And then we wanted to let you know that we do have our October Learning Collaborative topic identified. We'll be talking about addressing health-related social needs through community engagement, fostering relationships to connect people to care. So we're very, very excited about that topic. You can register for that on our website on the Learning Collabs page. This is also where all of the recordings of previous Learning Collabs will be posted, including today. So if you're interested in exploring some of that previous content, definitely check that out. Would be great to have you join us next month as well. And we will wrap up today by just inviting you to provide any feedback about today's content. You can use this QR chat to pull up the brief survey, or I will also include the link in the chat. We would love to hear your feedback and any topics that you'd love to see us cover in future learning collaboratives. So do feel free to take a few moments. I will include all of those links in the follow-up email, which will be coming out in the next few days. The slides will be for today will be available by email in the next day or so. We will send those out, and the recording of today will also be available on that Learning Collabs page within the next week or so. So please don't hesitate to reach out to me if you have any questions related to learning collaboratives, or if we can support you in any way. And thank you so much, everyone, for attending. Thank you, Alex, Kristen, and Kelly for presenting today. We really, really appreciate your expertise and knowledge, and we hope everybody has a wonderful day.